Once you get familiar with the cardinal signs, you can practically make this diagnosis from the doorway of the patient's room. Flexor tenosynovitis is a can't-miss diagnosis. Unfortunately, it doesn't rely on fancy lab or imaging tests to make the diagnosis. It's all in the clinical evaluation. Flexor tenosynovitis is an inflammation and infection of the synovial sheath surrounding the flexor tendon. What we're looking for on evaluation are the 4 Knavel signs to make this diagnosis. Number 1 is that the patient's finger is going to be very swollen. It's almost going to look like a little sausage. Number 2 is that the patient is going to preferentially hold that finger in flexion. Number 3 is that they're going to have tenderness along that flexor tendon sheath all the way up into the palm. And then finally, number 4 is that the patient's going to have excruciating pain with passive extension of that digit. The presence of all 4 Knavel signs is diagnostic for flexor tenosynovitis. Get your hand surgeon on the phone, update the patient's tetanus, get that digit elevated, and then you want to start anti-staphylococcal antibiotics. The more familiar we are with this disease and those 4 Knavel symptoms, the more likely we're going to make this diagnosis rapidly and save that patient's digit.